Buongiorno, mi sentite? Buongiorno, buongiorno a tutte e a tutti. Per chi non mi conosce, io sono Alessandra Petrucci e sono, in questo caso, visto che tutti quanti dobbiamo vestire il nostro piccolo pin di idee, sono il Presidente del Consiglio d'amministrazione appunto del nostro ecosistema DE. Poi sono anche rettrice dell'Università di Firenze, ma in questo caso voglio presentarmi appunto a voi come una comunità, siamo tutti una comunità. Dirò solamente due parole, mi piaceva, visto che questa è un'occasione molto importante perché ci ritroviamo tutti i partecipanti, tutti i componenti di DE qui insieme, mi piaceva ricordare un po' qual è stata la nascita di questo ecosistema e anche un po' il significato, penso, che dobbiamo tutti quanti tenere bene in considerazione. Allora, DE è nato sostanzialmente perché volevamo dare una risposta chiaramente regionale, perché DE è un ecosistema regionale, sapete che fa parte di quella misura degli ecosistemi che appunto dovevano coinvolgere fortemente il territorio, in questo caso appunto la regione infatti è stata sicuramente molto ascoltata, ma soprattutto è stato voluto per collaborare tutti gli atenei della Toscana insieme, che non sono pochi, siamo 7, e in più ovviamente la grande area del CNR, perché se non sbaglio ora la professoressa Carrozza non è qui presente, non mi può correggere, ma l'area fra Firenze e Pisa è senz'altro una delle più grandi d'Italia, quindi un importantissimo insediamento del CNR, e poi abbiamo anche diciamo così, degli sconfinamenti territoriali dell'IT, e insomma siamo un gruppo fortemente motivato a voler fare questo ecosistema. Non abbandoniamo certamente la nostra appartenenza, ma abbiamo deciso di metterci insieme proprio perché insieme si è più forti. È un po' una frase scontata, però è anche, secondo me, molto vera, specialmente in una realtà come la nostra, quella della Toscana, che presenta effettivamente delle eccellenze incredibili, ha una vicinanza, come dire, percorribile, non così difficile da colmare, quindi siamo vicini, dobbiamo sentirci sempre più vicini, dobbiamo mettere insieme le forze, perché appunto insieme riusciamo, come potete vedere, a realizzare dei sistemi, e in questo caso degli ecosistemi, che poi si possono vedere nazionalmente e io penso anche internazionalmente. Ricordo solamente che questo è l'unico ecosistema totalmente dedicato alla salute, che è un tema importantissimo, come sapete, non devo certo ricordarvelo, siete tutti molto attenti a questo aspetto e tutti in ambiti diversi lavorate per questo. Credo anche che questo possa essere, proprio la salute, un elemento centrale della nostra regione, la nostra regione appunto la Toscana, regione della salute, e credo anche che col nostro spirito potremmo dare effettivamente un forte contributo anche per un miglioramento tangibile, che forse è quello che si aspettano anche le nostre amministrazioni, la nostra soprattutto amministrazione regionale. Ora l'assessore Marras arriverà appunto a una serie di impegni, ma sicuramente verrà a salutarci. Io lo anticipo e spero che dopo ascolti queste parole, in modo tale che anche la Regione si senta assolutamente committed insieme a tutti noi. Quindi grazie per essere qui, essere così numerosi, siamo tanti comunque, e buon lavoro, e spero davvero che queste giornate siano molto proficue anche per ulteriormente spingere il nostro DE. Auguri e buon lavoro.
Let's switch to English, so welcome everybody. I will be your moderator today, and I am Andrea Frosini, Tuscany Health Sciences. I'm very glad to introduce Marco Pierini, next speaker, who will be telling us about the Tuscany Health Ecosystem in the framework of the activities that we are going on since the last 2 years. Thank you, Marco.
Come faccio ad andare avanti qui? Sai? Ah, ecco. May I have the slides? Okay. So good morning. So first of all, thank you, Mr. Chair, for your kind introduction, and good morning, ladies and gentlemen. It's a great pleasure and a big honor for me to introduce to you the Tuscany Health Ecosystem, which, as already mentioned by the Professor Alessandra Petrucci, is one of the 11 ecosystems funded at the national level within the NextGenerationEU program of the European Union. So it's funded by the Italian Minister of University and Research. The partners, as mentioned already by Professor Petrucci, we have 22 partners within this consortium, and those are 7 universities, 3 research institutions, 2 foundations, 1 moral entity, 1 incubator, and 8 companies or industries. And the scheme used for all these ecosystems is the typical hub-spoke system. I will explain a little bit more in detail in a few minutes, but as you can see, beside the spokes, with the hub, we have 10 different spokes, each one of which has a leader and different members as affiliated partners, which are working together for the scope of the single spoke. The ecosystem, the Tuscany Health Ecosystem, is in line with the Smart Specialization Strategy 2021-2027 of the Tuscany region. In fact, as you can see, among the application field of the strategy, we have the health. And if you look to the technologies, you can see that we are somehow using 3 of the different technology, which are digital technology, innovative material and nanotechnology, and technology for life and for the environment. So those are fully part of the ecosystem. So as I said, the ecosystem is fully in line, as it was supposed to be, with the regional strategy. The mission of this ecosystem, as already mentioned by Professor Petrucci, is to create a regional ecosystem in the field of life science. This means to put together all the stakeholders which are active in this field, meaning, of course, the industry, the research centers and the universities, but also the clinical centers and the incubators, and last but not least, also the local institutions, local administration, especially the regional one, which, as already mentioned, had a very active role in promoting the ecosystem in this specific field. And of course, moreover, the mission is to translate the research towards the market, and to, in the last sense, to transform the public investment into value for our society. So the goals is to provide solutions in terms of products, in terms of services, and eventually in terms of business activities. So the sense of the, as I already said before, of this ecosystem is to translate the research of very high quality performed in the region into to the market and into value for our citizens. Coming back to the structure of the ecosystem, Tuscany Health Ecosystem, as you can see, we have, there is a pointer, I think. In the center of the ecosystem, there is the hub, so the Tuscany Health Ecosystem, to which we belong. And then we have 10 different spokes. Among them, 2, number 5 and number 10, are so-called transversal spokes, while the other 8 are vertical spokes, working specifically in some field. It's also worth to mention that overall, we are involving around 1,400 different people. So it's a very big, huge, say, number of people involved, researchers mainly, involved in the ecosystem. So really all the region is involved in this ecosystem. The ecosystem contributes to 5 different cross-cutting challenges, which are here indicated. So, fight cancer, neurocognitive disorders, AI and innovative technology for health, cardiovascular health, and digital health and new organizational models, which are somehow provided by the different spokes mentioned before. Let's have a look very shortly to the different spokes, so you can also be introduced to the spoke leaders. So spoke 1, advanced radiotherapies and diagnostics in oncology, which is led by Leonida Gizzi, Leo for the friends, from the CNR, so the National Council for Research. While spoke 2, preventive and predictive medicine, as spoke leader Rossella Marcucci from the University of Florence. Spoke 3, advanced technology, methods and materials for human health and well-being, which is led by Professor Filippo Cavallo from the University of Florence, while spoke 9, robotics and automation for health, is led by Professor Vincenzo Ferrari from University of Pisa. Going ahead, spoke 4, nanotechnology for diagnosis and therapy, is led by Dario Pisignano from the University of Pisa, while spoke 6, precision medicine and personalized healthcare, is led by Nicola De Stefano from the University of Siena. Then we have spoke 7, innovating translational medicine, led by Luisa Bracci, also from the University of Siena. And spoke 8, biotechnologies and imaging in neuroscience, is led by Tommaso Pizzorusso from Scuola Superiore Normale in Pisa. And lastly, spoke 10, population health, led by Nicola Bellet from Scuola Superiore Sant'Anna of Pisa, and myself as leader of spoke 5, implementing innovation for healthcare and well-being. Moving towards the conclusion of my short introduction, a few words about spoke 5, which I'm leading. The objective is to increase the level of TRL of our research with many different activities. Just to mention some of them, providing strategies for protecting the know-how, providing support for startups, creating networking opportunities. Today's and tomorrow event is part of it. Providing also regulatory support and also training for our researchers for cross-disciplinary skills. We also organize hackathon focuses on medical needs. We do that also by the support of personnel which have been recruited and trained specifically for these activities. So we have several technologists that has been recruited and as I said, they are supporting our research in all these activities together with the KTO offices of the different member partners. So in the end, the aim of the Tuscany Health Ecosystem is to create a bridge between the research and the market in order to provide value for our society. Thank you for your attention.